Constant pain in the neck, whether it's dull, whether it's sharp, achy, shooting into your shoulders, shooting up to your head. If any of these have you saying, that's me, and you're also wondering, is that coming from my posture? Then this video is for you. In this video, I'm going to talk to you about normal posture, abnormal posture, different positions that your head might take through the course of the day, understanding about the muscles, tissues, ligaments, and nerves in this area so that you can better equate or relate your neck pain to your posture if that's the case. I'm also going to give you some home exercise and workplace tips to make sure that you can minimize that neck pain and improve your posture at the same time. Hi, I'm Dr. Josh Gelber, chiropractor in Toronto, Ontario's Annex neighborhood. This channel is all about giving you insights, strategies, and the help you need to have optimal posture, more freedom, and less pain. So what is normal posture exactly? Most of us know it, but sometimes we don't visualize it on a regular basis like a chiropractor tends to. Looking over the Posture Perfect poster, this young man looking from the side and from the rear is showing us a more optimal posture. On me, that's making sure my head is carrying over my shoulders, that the back of my hands is facing more outward versus forward. My chin is in. My ears should sit over the shoulder bone as close as possible if you dropped a straight line down. And then we look at the options and the comparisons of poor posture. The head can be slouched forward. There can be a tilt in the hips. There can be a drooping of one shoulder. That would look perhaps something like this. Could be something not as exaggerated as this, but in that general sense. The first test I perform with people is a postural analysis. It's amazing what you can see in very subtle elements, whether it's a twist of the neck, whether it's a tilt of the head, a shift of the shoulders, a swaying or a twisting of the middle of the spine. All of these count as poor or less than optimal posture, which usually indicates there's a spinal alignment issue below the surface. So that's what poor posture can look like on the outside. But on the inside, the curve of the neck is essential, it's critical. When we start having this type of forward head posture, drooped shoulders, arms shifting forward, we can have that type of neck position where there isn't a curve going on. There can be some curve and compensating forward. There are other examples where I see x-rays of a backwards curve. No curve, straight neck, lots of variations. As you'll see in these images, there's plenty of musculature surrounding the spine. When that spine loses its poor position, and that can be based on bad postural habits, that can be based on leaning into that computer monitor, smartphone. I catch people all the time in my office like this versus like this. The muscles that connect from the base of your skull down to the shoulders will have strain or get tighter by having poor posture. And as those muscles get tighter, they get knots, they get weaker. Typically, that causes some distress, usually stiffness, that pulls on the ligaments that connect the vertebra, the spinal vertebra together. That can have an effect on the length of the musculature. But ultimately, what tends to happen is all of that tightness, muscle strain, ligament pull, and poor alignment may have an effect on the spinal nerves. It's a small image here, but there are plenty of nerves coming from the brain and off of the spinal cord through the neck that control everything in the neck area, out to the shoulders, down to the tips of your fingers. If there is poor posture and strain and tension and alignment issues in here, those nerves get compromised. They get irritated. Some medical professionals will say pinched. It's an in-between situation, but if there's friction, irritation, disturbance with those nerves, that's typically where a pain signal comes from. Now that you have a better understanding of the anatomy and the components that lead to having neck pain from poor posture, here are 4 take-home tips and strategies that can help you try to reduce that neck pain, improve your posture at the same time, and give you some comfort and freedom. First one I'm going to show you is the chin tuck. Now, this is a great exercise to relax the muscles that, again, go from the skull down to the neck and bring some stimulus to the weaker, less active muscles in the front of the neck. You can set yourself up against the wall. You can just be seated at your desk chair, whatever you'd like. Step 1, you're going to make sure that your shoulders are square and up. And then, just like my finger is indicating, but you don't need your finger, you're just going to start to bring your head backwards. You'll feel some slight pressure around your throat. You may feel like you're creating a double chin for yourself. That's okay. No one's watching. And you're going to hold for 3 seconds at a time. So you're going to go back, straighten up, chin back, hold for 3, and relax. Repeat this at least 10 times. If you want to set the bar higher, go for 20. You can do this multiple times a day if you find it really helps and relaxes the back of your neck and stabilizes that comfort level. Action number 2, and these always feel great once you get through them, are the wall angels. This one needs to be up against a wall, something smooth, a flat surface. What you're going to do is put your arms up like someone's pointing a gun at you. You want to make sure as best as possible, and for those of you with a more rounded shoulder or really tight anterior front muscles because of that posture over time, it might not look as perfect as this. That's okay. Put your shoulders up, put your elbows back against the wall, and try as much as you can to have part of your hand or knuckles also touching the wall. And from there, you're going to slide up as high as you can with both arms. Don't force this. And as low as you can so that your elbows come down. The goal is that your elbow and hand, both sides, stay flush against the wall. If you can have your head against the wall, it's a bonus. It might not happen together. Do this 10 times. Bonus points for yourself if you can manage 20. No hero required, just work towards that. Also, multiple times a day. The third activity might be pressure point based for you, and it might be stretch based. For some people, when their muscles have so many knots or tight bundles of fibers, it's like cooked spaghetti that got clumped together. You can't stretch it apart, you need to break it down. You might use a tennis ball or a trigger point ball like the one you see here. And if you have a partner who can use that and dig into the muscly, meaty area in the top of your shoulders, great. You can find a way to lean against a wall and just push yourself or exert pressure backwards. You'll find the tender spots. You can hold there for up to 5 seconds, roll around a bit, find a new spot, and I would say 4 to 5 times in a row. Check both sides, obviously. Some of you might find it as effective to do a stretch. I call it, or I laugh at it, it's the smell your armpit stretch. And what you're going to do is turn your head to the side, reach with your hand back behind the opposite ear and hold on the skull. And as you turn your nose towards your armpit, that's why the name, gently tip your head down and gently pull from the back of the skull. You should feel that into the base of your neck and your upper shoulder. You can hold this stretch for up to 30 seconds at a time. Take deep breaths, relax your posture as you do it, let yourself go into that stretch and let your hand do the work. If this aggravates, stop. Just like the ball, if you find major discomfort, stop, seek some help, seek counsel. You should be able to do either of these comfortably if you're not overdoing it. And you can do the stretch for 30 seconds 3 times, pressure point 3 to 4 times as I mentioned. The last one I'll work you through is just a posture check. I was inspired by a running instructor, I think related to the running room a number of years ago, imagining a string tied to your breastbone, your sternum, that chest plate here, and imagine it's just being pulled in the upward direction. And you want to repeat that movement of string pulling you up, hold, and release. You can even over-exaggerate this position and just go up so that you feel some activity in your middle back, and just feeling the openness of that posture. For some of you, it might not be challenging. For others, you might feel really tight. So just gauge your frequency and usage depending on how it feels. If it's really easy, this exercise isn't as beneficial to you. If you struggle a bit with it, keep going. Holding that posture up, I'd say up to 5 seconds, and relaxing. Repeating up to 10 times. And while that posture is up and open, take a nice deep breath. You may feel your lungs feel a bit fuller by having that more upright posture. But really envision that string tugging upwards and just being let go, and tugging upwards and repeat. Those 4 strategies should give you a great head start on helping to relax your neck, stretch out or release some tightness that's going on, hopefully reduce some of your neck pain. If you've done them before, if you find that they're not really helping, there may be an alignment issue going on below the surface. That's where a qualified chiropractor can step in. One that does posture testing, nerve scanning, hands-on analysis, and x-rays to have a really thorough understanding of what's going on for both that chiropractor and yourself to be able to proceed with a course of care or an adjustment plan that produces results. Please comment below with which exercise or stretch you found the most beneficial. If they weren't effective and you'd like to request additional ones, leave that in the comments. Be sure to like this video and subscribe to our channel. Lots more content coming. We'll see you soon.